All right, good afternoon, everyone, and welcome back again to another webinar hosted by Generali Philippines. I am Deo Castillo, a Senior Account Officer of Generali Philippines. Now, as we all know, the COVID-19 pandemic has disrupted many aspects of our lives, including how well we sleep at night. Many people suffer from sleep issues before COVID-19, and unfortunately, COVID-19 created new challenges even for people who previously had no sleeping problems. Isolation, loss of work, economic and health worries, and disruption to your work, school, and home life can increase stress, anxiety, and depression. These, in turn, can play havoc with your quality of sleep. You may toss and turn at night, unable to sleep no matter how tired you feel, or wake up in the middle of the night and struggle to get back to sleep. There is a definite impact on our sleep and mental health. Now, what could be the best way to cope up with this? This afternoon, we are privileged to have with us a sleep specialist, and he will discuss about how to remain healthy in a time of COVID-19 by getting good and quality sleep. This webinar is in cooperation with Sleep Science, a part of United Health Services Group of Unilab. Sleep Science is the first provider of integrated sleep analytics and solutions in the Philippines. A few reminders before we start our program. Everyone will be put on mute mode to hear our speaker clearly during his talking segment. You can still engage with us through the chat box below on your screen. Feel free to write down your questions for our speaker. The live Q&A box will be open during the latter part of the talk. Again, if you would like to ask questions, please type it down in the live Q&A box which will be available at the latter part of the talk. You can type your listed questions there, and we will do our best to answer it during the Q&A segment. So without further ado, let's begin our program. Our speaker for today specializes in ear, nose, and throat, head and neck surgery, sleep medicine and surgery, and transoral robotic surgery. He is the immediate former president of Philippine Society of Sleep Medicine, the center head of St. Luke's Medical Center's Comprehensive Sleep Disorder Center, and the program director of their Sleep Fellowship program. Moreover, he is presently an assistant training officer at the Department of Otolaryngology, Head and Neck Surgery, and an assistant professor at the College of Medicine, both in St. Luke's Medical Center. Everyone, welcoming to our screen, Dr. Keith Aguilera.
Hello, thank you, Deo. Thank you for the kind introduction. So I'm just gonna prepare my slides and share my slides so that we can begin. Okay. So thank you very much for Generali for inviting me. I'm glad that, as part of your wellness meetings and wellness promotions, you've included sleep. And I'm glad that, a lot of people are actually becoming more aware of sleep. Oftentimes we take sleep for granted. Okay, sometimes short sleep nowadays seems to be a bragging right for some of us. You tell other people that your sleep is actually short. I did this and that. It's kind of sign of you being industrious. But we all know that exercise and eating properly are essential for our well-being. Most of us forget about the other part, which is sleep. And hopefully today I'll be able to explain why sleep is important, why sleep shouldn't be taken for granted. And to begin, basically what we're going to be going through for this afternoon would be, for one, to start, we have to understand what human sleep is, okay? So we have to understand why we sleep and what triggers us to sleep or what makes us sleep. And we would like to, I would like you to learn the benefits of a normal sleep so you wouldn't be taking them for granted. Of course, sometimes despite having the best habits for sleep, some people will still have problems with sleep. And I would be discussing some common sleep disorders. And hopefully by the end of the session this afternoon, you'll be more aware, at least of yourself, of your sleep health, and you can hopefully not take it for granted anymore. So how long should you sleep? So this is the most common question that we get. And how long should we always sleep? And the answer to that is a little bit more complex. So the National Sleep Foundation actually has a recommendation for sleep. And for adults, as you can see in the figure, for adults, we need to have about 7 to 9 hours of sleep. That's from above 18 up to the time that you get, to the geriatric age group. However, as you go down on the younger patients or younger people, they seem to have longer sleeping hours. They need longer sleeping hours. And this is quite essential for children, for younger children, for babies, up to about the time that they're studying. And eventually you learn, hopefully in the presentation, why it is important to sleep this long. And it is also important to teach them proper sleep habits from early on during childhood. And this would eventually lead to better development as they get older. So in general, if you ask how long should be able to sleep, sagot dyan is 7 to 9 hours. And those that are above 10 to 11 are, somehow acceptable to some degree, or even sleeping at 6 hours is acceptable. But beyond that, all those orange bars or orange shades, those are unacceptable sleeping hours per age group. Okay? So what drives us to sleep? Bakit pa tayo natutulog? So basically, when we sleep, it's dictated by two mechanisms. One is what we call our circadian rhythms or our internal clock. Humans are what we call diurnal beings, meaning you sleep and you wake up, you sleep during the night and you're awake during the day. That's why, which is where the circadian term actually originated from. And if you look at the circadian rhythm cycle, each particular time of the day, there's a specific mechanism or specific physiology that happens. You're drowsy, your deepest sleep actually occurs at this time at about 4 a.m. That's the lowest body temperature. 6 o'clock is when you wake up. And shortly after you wake up, that's when your BP starts to go up and you have your melatonin secretion starts to deplete and so forth. So these things happen despite not having, I mean, they happen automatically, whether you like it or not. These are the things that your body goes through during the day, and sleep is one of them. And if you can look here at the bottom, you can see that the temperature actually dips down towards the night and it goes further down. That's why the peak of the lowest body temperature is actually at 4 a.m. And that's the time that you get your deepest sleep around this time. So that's the circadian rhythm. So whatever you do, you go to sleep at night, you wake up in the morning, all the other physiologic mechanisms in your body will start to take place, and all of that would occur every cycle. The problem with the circadian rhythm is that, by the way, talking about siesta, this is this is also part of your circadian rhythm. So at the mid-afternoon, there's usually a dip. So this is actually not a good time to deliver a lecture. So hopefully, if hopefully, um, you won't take any naps this afternoon. But if you do, it's acceptable. That's why siesta seems to be a physiologic function. So between noon to 6 p.m., around 3 or 2 p.m., that's when you start having a little dip, and that's why we get sleepy around this time. So the problem with the circadian rhythm is that the circadian rhythm doesn't run 24 hours. Para siyang Buddha. Buddha actually is open 25 hours now. But for humans, our sleep cycle actually, or the circadian cycle, occurs for about 24.2 hours for adults and a little bit longer for adolescents. Why is this important? So if you see, it's more than 24 hours. It's 24.2. So if you don't actually have any cues, meaning you just allow the circadian rhythm to cycle through the day, every night you sleep a little bit longer, a little bit later pala. A little bit later, you wake up a little bit later, and that can progress your sleep. Pwedeng palate ng palate yung sleep time ninyo and your wake up time. That's why it's important that you entrain. So when you entrain, that means you have to synchronize yourself with the environment. And among the environmental cues, the strongest one among them would be sunlight or light. So sunlight is the strongest, but it can be, it can come from an artificial light source like a light bulb. So it's the most important exogenous influence. And once you get exposed to bright light, it suppresses your melatonin production and it enhances your alertness. And it kind of resets the circadian rhythm. So para magsa-start ulit siya at that time. So it's important to entrain yourself so that your circadian rhythm would actually homeostasis means basically there's an increasing sleep drive during continued wakefulness. So basically it means the longer you stay awake, the more you would increase your sleep drive. So this is in this graph, you can see the process C is the circadian cycle, and the process S would be your homeostatic drive. So the S increases as the more you are awake during the day, it increases further. And as it increases, your sleep drive actually increases. So pataas ang sleep drive. The more tired you become, the more sleepy you will at night. So until it reaches to a point where in both the circadian would start going down. And this is a time that you actually go to bed. So mataas na rin yung sleep drive ninyo, and that would actually push you to sleep. And as you sleep, your homeostatic drive actually recovers, kaya nawawala siya. And then until you actually replenish, mawawala yung sleep drive, you're more refreshed in the morning when you wake up, and it would start to accumulate again. So that's important. And this is one reason why you would notice that every time na magpupuyat kayo, every time you extend your work hours, and this is common for people who goes on shift work, meaning they work on hours that are supposedly your sleeping hours, but instead you're working. And the sleep drive actually increases beyond the normal level, and it causes additional sleep pressure. So that's why the following night, mas malalim yung tulog mo, you have an increase in slow wave sleep, and there's an increase in your total sleep time. So you would notice that the longer you lack sleep, the higher the drive would be. This is also what we call sleep debt. So it can come to a point wherein kapag lagi kang puyat and then you're lacking sleep and it becomes habitual, your sleep debt or sleep drive actually increases. Sometimes it increases to a point that you cannot stop it anymore. So you cannot control it. And then you would have, these are times that you would just fall asleep while you're sitting in the car or in a boring meeting or in a boring lecture. That can happen. So the sleep debt can overcome whatever that you're doing and then would make you fall asleep. And it's quite dangerous if you're actually driving or doing some mechanical work that can eventually lead to accident. However, not everyone's created equal. So those are the basic functions, but different people or different individuals would have different reactions. And that's because of our individuality. There's such a thing as what we call chronotype, wherein we have people who are early birds or the larks and those that are night owls. So basically, there are people who sleep early, wake up early, and they're more alert during the day when they wake up in the first part of the day. Whereas others, they actually work best at night. So the later they seem to be working better at night, they seem to be more creative at night, and they seem to sleep later. And when they wake up, have a hard time waking up. They have a hard time concentrating whenever in the first part of the day. They usually are more productive at night. So try to, you can actually gauge yourself whether you're a morning person or an evening person. There's a questionnaire that you can search on the web. It's called the Morningness and Eveningness Questionnaire, and um, it can help you understand what kind of what kind of if you're a what kind of chronotype you have. So there's also a factor of age. So as you age, as we've seen in the earlier graph, um, the younger people would have longer sleep as compared to older people, and has longer sleep requirements than older people. And even the way people sleep also changes. So it's not only the duration. People, as you get older, you have more awakenings. So that means that you have more awakenings in the middle of the night. You wake up in the middle of the night several times as compared to before, that you don't wake up, you sleep straight. And your slow wave sleep, which is your deep sleep, actually becomes less as you get older. REM, which is the sleep, this is the sleep part wherein you dream. Stage 1 and stage 2, which is your light sleep, seems to be unchanged as you age. Okay, so this is a nice data. I'm sure some of you would have some fitness bands. You have Fitbit, you have Huawei, Apple Watch, and all those other fitness monitors. And some of them actually monitor your sleep. It's not as accurate as what we do in our labs, but the Fitbit or those fitness gadgets can actually give you a glimpse of what kind of sleep you go through every night. And this is interesting because in 2017, Fitbit actually released data of a million nights of different people around the world. And it would show you, though it's not very accurate when it comes to the degree, but volume, the amount of data that they showed does mean something. So is there any difference between men and women? It seems like there's a little difference with the way men and women sleep. It's about 7 hours based on the recommendation, but you will see in real life experience, people actually sleep for about 6.5 to almost 7 hours for women. The sleep stages remains quite the same for men and women, so there's no difference. Then you look at the sleep schedule. This is a Gen Z, which is the youngest of the group, versus the baby boomers. You can see that the baby boomers are actually sleeping much earlier, almost an hour earlier than those of the Gen Z. And the wake up time is also different. They wake up much earlier than those that are of the Gen Z. So the duration seems to be different as well, but maybe not to that much degree. Still 6 hours, 6 hours and 30 minutes for the baby boomers, and just an additional 20 minutes for those that are in Gen Z. Again, the type of sleep stages that you go through doesn't seem to be very significant. So you go through the same amount of REM sleep, same amount of light sleep. The deep sleep kind of decreased a bit. Okay, so why do we sleep? Well, there are many theories, but basically we still don't know why we sleep. So there are theories that would say why we sleep, the exact physiology of why we actually sleep. There's no direct answer to that, but mainly it's for the repair and recovery of our body. The reason why we sleep is because of the during the day, the more time you stay awake, the more wear and tear your body goes through. And they say that when you go to sleep, this is the time wherein your body repairs. And the body repairs you in different in a lot of aspects. There's a secretion of a lot of growth hormones during sleep. And the growth hormones that are released during sleep actually improves muscle growth and cell regeneration. So ito yung mga damages ninyong nagawa during the day. The sleep actually regenerates all those cells so that they would gain their strength again, or for children actually, that's where muscle growth actually occurs. There's also clearance of neurotoxins in the brain. So as you are more awake, your brain functions, it can actually have some byproducts inside the brain. The byproducts in your brain can be toxic to your brain if they're not cleared. And this is one reason why people sleep, is because they say that when you sleep, the toxins that you accumulate in your brain are being washed out. So naka-cleanse siya every time you go to sleep. And this is a more popular recent study that they're going through. It's becoming more popular these days, and there are more and more studies coming out. Is that it can also cause early Alzheimer's or memory loss, because one of the toxins, which is what we call the beta amyloid, is not actually cleared very well inside the brain. And when this happens, it accumulates in the brain. It kind of affects the connectivity of the nerves inside the brain, and that could lead to early dementia or early Alzheimer's disease. Also, it is very important for learning, especially in children. So when you sleep, a lot of things actually happen in sleep. In fact, cognitive function and memory are actually one of the main functions of sleep. And for newborns, that's when their brain starts to develop. So very important, yeah. So sometimes you are in a dilemma whether you're gonna just finish whatever you're studying or just sleep. My suggestion there is you actually just sleep it over. So there's more recollection of what you've actually studied. Maski sabihin mo, hindi mo natapos yun, but you have more recollection, and there's more, you must stay imprint inside your brain, and you would remember them the following day, as compared to if you would actually study the whole night and not sleep. So another important thing about sleep is the sleep stages. The sleep stages, you go through the different sleep stages. You go through a cycle of light sleep, deep sleep, and then REM sleep. And in everyone who sleeps, you have to go through all these cycles during the night. It occurs about 4 to 6 cycles every night that you sleep. Everyone dreams. You may not remember them, but you do dream. Because in each sleep stage, there's a function that has to be, that happens inside your body. Whenever you go to deep sleep, that's when your wakefulness actually improves, meaning that's when you become more refreshed when you wake up the following day. That's a lot. There's learning that occurs, cognitive function occurs during deep sleep. And in REM sleep, they say this is where the psychological well-being actually occurs. It consolidates complex learning. That's why in dream sleep, they say if you lack REM sleep, in the following day you become very emotional, you become grumpy, become very labile. And that's because with sleep, when you start dreaming, that's when your emotions are actually fixed. And they also say that when you dream, it seems to create, if you have bad experiences during the day or some experiences that occurred to you, and when you sleep, nawawala yung when you dream pala. When you dream, there's a toxic chemical or a stress chemical inside your brain that's absent. And these experiences are actually recreated and reprocessed without that stress chemical. So after dreaming the following day, whatever bad experience that you have, your brain seems to be able to accept that better, so that when you respond to a similar situation, you're not going to be responding in fear or responding negatively. Also, with dream sleep, this is also where creativity occurs. it seems to open up channels that you don't, the associations or channels inside the brain that's not common. So you start having novel connection between your dreams, between your memory, between your learning. And that's where creativity actually comes in. So you actually think outside the box, you think outside the norm. You seem to have different connections between your experiences and your memory. And this would create, those creative thoughts or learning that you might express during the day. So creativity is very important then. So you have a lot of processes that occur. And also sleep is actually makes you slim, because the hormones that occur that happen to secrete in your body, like your leptin and ghrelin. Leptin is your satiety hormone, which tells your brain when to stop eating. So tama na yan. So you stop eating, it should be enough. And ghrelin is a hunger hormone, which tells your brain to eat more. Okay. And they did an experiment on people, they sleep deprived people, meaning these people actually lack sleep than their usual sleep. And what happened was that their food choices became different. Even if they know nabawal siya, even if they know that they're taking much more calories, their sense of judgment became affected. And that's because of the lack of sleep. So it affects some part of the brain, which is basically your frontal lobe. And the food choices becomes different. So even if you know that they're not healthy, you would just still pick them. You pick sugary food, salty food, and all sorts of other stuff that is unhealthy for your body. And that's why, and also sleep uh, improves your metabolism, wherein if you lack sleep, you seem to be wasting more muscle than fat. So if you're lacking sleep, even if you exercise, you will start wasting some muscles if you do lack sleep chronically. So meaning habitual sleep ninyo. So for in order for you to have good sleep, you have to have sufficient sleep quality, quantity, meaning the duration, 7 to 9 hours, and you have to have good quality sleep. So meaning you have to go through all the sleep stages, your stage 1 and 2, your deep sleep, which is your stage 3, and REM sleep, which is when you dream. So if you don't go through all the sleep stages, or you don't have a good quality sleep, or you don't have a good quantity of sleep, that's when sleep deprivation actually occurs. So there are two kinds. So what are those? Basically, we just classify them into acute and chronic sleep deprivation. When you say acute, it can last for a few days. And when it's chronic, that means you routinely sleep less than the amount that is required. So what happens when you lack sleep? Okay. And I'll explain that in a while. So some factors that can cause chronic sleep insufficiency would be family, social responsibilities. Sometimes when we work late, and then when you come home, you still have other chores that you have to do. You have to attend to children. You have other responsibilities or social responsibilities. You go out with your friends. Work demands, sometimes too much stress, you can actually bring it home. It can actually affect your sleep. You can have medical conditions, like if you have a heart disease, and which is also common for people who have a pain disorder, so they can't sleep properly. Or sometimes even if you don't have the medical condition, or one of your family member has a medical condition that you have to take care of, that could also affect your sleep. And if you have sleep disorders, which I will I'll run through some of them later in the discussion. So acute sleep deprivation usually leads to cognitive effects, so meaning your thinking is affected, your mood and judgment, sleepiness, microsleep, circadian factors, and inter-individual variations are some of the effects of acute sleep deprivation. So for mood and judgment, usually that would result to some mental state that resembles depression or anxiety. You have poor mood, you have irritability, low energy, decreased libido, you can have poor judgment. But the difference between an actual psychiatric problem and a problem that's due to sleep deprivation is because if it's secondary to sleep deprivation, it's reversible. So that means it can, as soon as you get back to your old sleep or your usual sleep, all these poor judgment, irritability, depression-like symptoms, and anxiety would actually disappear. Sleepiness and microsleep can also occur in sleep deprivation. Remember the discussion earlier about sleep debt. So this can happen. Sleep drive can intrude into wakefulness, and it's not always under the control of the individual. So minsan di mo siya mapipigil. When sleep attacks, we call them sleep attacks talaga, it will attack and you don't have any control. That's why sometimes it becomes a bit embarrassing. And of course, it also affects your circadian. So what do you mean by circadian factor? So meaning if you have sleep deprivation, later on, parang namumove yung cycle ng sleep mo. So sometimes it gets delayed, it becomes more delayed through the days. And later on, you would sleep late, and then you can't wake up the following day at your desired wake up time kasi antok ka pa. So you tend to extend your sleep. And this would actually ruin your circadian rhythm and your cycle. So na magkakaroon ka ng yung parang mistiming, like you're working in a shift work or a jet lag, parang ganun yung effect, but you're not actually traveling. Pero yun ang same effect to that. So there's also inter-individual variation. So not everyone would be sleep deprived would have the same effect. So some people, they'll be stable even if they're lacking sleep, they would still function well. There's also genetic predisposition, especially if it runs in the family, yung mga insomnia and things like that. You become more prone to the effects of sleep deprivation. For chronic sleep deprivation, you have a list of all the things that can happen. But in chronic sleep deprivation, this is where it becomes a little bit scarier. So you can get multiple or repeated car crashes or near misses. We do get patients who experience this. So apat na kotse na nasisira nila before they actually try to seek our help. And in the US, it's quite a huge amount of money if you get into a car crash, freeway, usually multiple vehicular accidents. And it is exaggerated if you have existing sleep disorders like obstructive sleep apnea or if you have some alcohol abuse. So quality of life is affected because basically you don't have enough energy. It can be a source of embarrassment and friction in school, in work, in your family. So there's a lot of things that can happen. Data in the US, there's increased divorce rates for people who have chronic sleep deprivation. There's a reduced job satisfaction, decreased family and social interaction. And of course, this is something that I'd like to emphasize. It also affects your children. There's poor school performance and behavior problems in children. So why is this? Ikaw yung may problema, but your children are also affected. It's because it affects your relationship with them. So if the dynamics in the family becomes affected, it can trickle down to your children or to your wife or husband. So cardiovascular morbidity, so you can develop hypertension, you can actually increase risk for having heart attacks or chest pain. In fact, in 2016, there was a scientific statement from the American Heart Association that the sleep restriction is actually recognized as a risk factor for adverse cardiometabolic profiles and outcomes. So meaning risk factor na siya together with blood pressure, cholesterol, diet, blood sugar, diabetes, physical activity, weight gain, and smoking. So kasama na siya. So they've recognized that it's also one of the triggers that can lead to cardiac morbidities. And immunosuppression, those who have chronic sleep insufficiency would develop problems with their immunity. They become more sickly. They get easily infected with the common cold, especially now because of COVID. Your susceptibility actually increases because of poor sleep, if you do have poor sleep, and even for vaccinations. So if you are actually sleep deprived, they did an experiment, sleep deprivation for 6 days before the vaccination, your immune response to the vaccination is not as robust. So even sabihin, your immune system doesn't develop what was expected after the vaccination. So quite important. Everyone's getting vaccinated nowadays. Try to get some good sleep before your vaccination date. And of course, as we mentioned earlier, it can lead to obesity and metabolism. Even some acute sleep deprivation can lead to bad food choices. Just imagine if you're chronically sleep deprived. So for the sleep disorders, we actually have more than 80 sleep disorders that we can discuss, or we know, or at least what's written in the International Classification of Sleep Disorders. But for this afternoon, I'll probably be concentrating on a few, which is namely insomnia, sleep-related breathing disorders. I'll touch a bit on circadian sleep-wake disorders, which is one of them would be which is a shift work disorder. because these are the common sleep disorders that we usually see in the clinic and most commonly occurring in our population. So when we see patients in our clinics, usually they would complain either they have a hard time going to sleep or keeping themselves asleep during the night. They have a hard time staying awake during the day. So these are people who do sleep sometimes at night, sleep well, but they have a hard time functioning. They're still feeling sleepy during the day. So problema yun. If you sleep well at night, but during the day you're still sleepy or you have a hard time waking in the morning because you feel tired, then that means there's something wrong with your sleep. The duration might be good, but the quality is probably poor. Or there are things that can occur while you are sleeping, like nightmares, sleepwalking, sleep talking. Those are what we call the parasomnias. So for insomnia, so usually when you say insomnia, hindi yung basta hindi lang makatulog. Hindi lang makatulog, nahihirapan sila, they have a hard time maintaining their sleep or they wake up too early. That's what we call insomnia. But there are other classifications for it to become insomnia. It has to occur at least 3 times a week. And for people who are suffering insomnia, that means they have an adequate opportunity to sleep and circumstances to sleep. So ibig sabihin talaga meron silang time. Hindi yung busy ka na hindi ka nakakatulog o marami kang ginagawa. Hindi ka makatulog. So these people who are suffering from insomnia actually would have the right opportunity. They have meron talaga silang time to be on the bed. And aside from that, you should have daytime consequences. So meaning, aside from nahirapan ka matulog, given the right opportunity, it has an effect on your life, on your quality of life. It can lead to fatigue, poor attention and concentration, some social educational dysfunction, good disturbance, sleepiness during the day, lack of motivation, a lot of errors or accidents, aggressive behavior, hyperactivity, and also it feeds your ongoing worry about your sleep. So ito yung mga effects dapat. You should have some daytime consequence for the lack of sleep. And 3 months, basically, that's when if it's less than 3 months, we call it acute, or bago pa lang yan. And if it's beyond 3 months, that's when we call it to be chronic. And since we're on the topic, since the COVID started last year, they actually coined the term, which they call COVID-somnia. So basically, this is a kind of insomnia that's brought about by the COVID scene or the COVID pandemic. As we well know, it's because of the SARS-CoV-2, and it's global. Everyone's affected, and there's a lot of behavioral changes, as was pointed out in the introduction. There's reduced person-to-person interaction. We all have social distancing, physical social distancing. We also have we have distance socializing, meaning we still do socialize, but in a different way. I mean, who would have thought that we would be having Zoom as a lecture nowadays? We would have thought of it last year, not only because of the pandemic. There are changes in the sleep habits, physical activity, even habits, how we use electronics. All of that changed because of the pandemic, and there's a varied response and impact among different individuals, and it does affect our daily living and work. So what happens with COVID-somnia? So basically, put your Netflix kasi usually yan yung pinaka-common. You have delayed bedtime, you have increased napping, you have lack of circadian cues. So basically, work at home or you're just at home or you're just in a small place. You don't have your cues, you don't have your social cues, you don't have your environmental cues. That would tell you when to sleep, when to do this and that. And of course, since you're just at home and you can sleep anytime because sometimes your work schedule became erratic, especially during the first part of the pandemic when everything was locked down, you can actually sleep anytime you want and wake up anytime you want, and you can take naps anytime you want. And also there's emotional distress that occurs either because of the disease, you getting COVID, somebody getting COVID, somebody having COVID in the family. There's some financial problems that you can have, your businesses or whatever savings that you have, and also your employment. Some of us are lucky that we were able to keep our jobs, while the others were actually laid off because of of low revenue among their company. So all these things can actually lead to COVID-somnia. So the treatment, we usually ask patients to fill up a sleep diary. They fill up, because it's for about 2 weeks, we tell them to try to log what time you slept, what time you wake up, and how many hours of sleep did you get. We sometimes give medications, which can be a quick fix, but we usually don't do it in a long-term basis. And we do also initiate what we call a cognitive behavioral therapy for insomnia, wherein we introduce several ways of coping up with not having coping up with poor sleep. So we give them these are sessions that we give patients so that they can cope with their sleep problem. And surprisingly, despite the pandemic, I think I I'm not too sure about this, but I've read articles that say that the BPO industry did not shrink in size. In fact, they're predicting in 2022 the Philippines will cover about 15% of the total outsourcing market. It generated 1.3 million direct jobs for industries, but what's significant is the indirect jobs it actually created about 4.8 a million indirect jobs in terms of food, banking, real estate, hospitality, transportation, and other industries. So it's really a big industry um, that's uh, that's taking over the country, or a lot of people are actually engaged with. And the problem with shift work is that you are actually tasked to work on times that you're supposed to be sleeping or supposed to be preparing for sleeping. And they're in the odd hours because most PPOs are actually outsourced markets wherein you cater for industries outside the country, US, Australia, depending on the time zone that you serve. So those who are in the morning, early morning shift workers, they would develop difficulty in initiating sleep and difficulty in waking up. Those that are in evening shift work schedule would have difficulty initiating sleep before the major sleep period. So meaning because they need to go to work at night, so they would try to attempt to sleep earlier at their bedtime, and they would have a hard time doing that. And basically, everyone in the shift work industry would have a decrease in the total sleep time. They have poorer sleep quality. They can have sleepiness in their workplace, decreased productivity, and you can have irritability and social stress. So for those who are experiencing this usually are not fit for that kind of job. Maybe, or sometimes we can help. And but if despite all the help that we can give, there are people who really cannot tolerate shift works. And there are individual factors. In general, these are people who are more than 50 years of age, those who have you have a sleep disorder, pre-existing sleep disorder, they have insomnia already, or they have sleep apnea. And if you have an existing psychiatric illness, anxiety, most of the time, alcohol or drug abuse, if you have other medical problems like diabetes, gastrointestinal complaints like hyperacidity, things like that, and if you have a heart disease, they can all worsen if you start doing shift work schedules. So work factors can also affect the sleep of patients who go through shift work are those who have more than 12 hours of night shifts in a row, those who have less than 48 hours of rest after a run of night shift, so they're not given appropriate time to recover, and those who go through shifts without appropriate breaks in the middle of their shifts, and those who have excessive regular overtime. So these are factors in your work, which is a red flag. If you're seeing this, that means it's not a good work environment for you at all. So that's why shift work is actually a little bit hard to treat because there's an individual factor. You have to treat the individual. You also have to treat their household, meaning the family where they live in, and you also have to consider the work area that they work in, so that all of them have to be in harmony, so that they can improve the sleep of the individual. So another common thing that we see in the clinic, actually one of the most common, would be yung snoring, which is hilik. And it's not just the snoring that we worry. It's another form, one disease wherein we call the obstructive sleep apnea. So basically, when you snore, that basically means that your airway is narrow. So if you dissect, looking inside, you can see the tongue there, you can see the soft palate. Air moves freely as you breathe through during the night. Your oxygen's well, your heart rate is okay. But when your muscle starts to move, it would cause some narrowing in your airway, and that's when you would start snoring. So when you snore, ibig sabihin, masikip na yung daanan ng hangin mo. And this is what apnea is. You literally choke. So it can relax to a degree wherein you would choke. And then even if you're breathing, there's no oxygen that goes in, your oxygen would start to go down, and your heart rate would start to go down. And when that happens, your brain will wake you up. Wait, you don't have any more oxygen. So it wakes you up. And that would make you gasp for air. You would gasp for air, and then your oxygen and your heart rate would start to increase. And that would occur in cycles. So, and most of the time, people who suffer from sleep apnea are those who are 30 to 60 years of age. Most of them are actually men. Only a few are actually women. But women would start to catch up once they hit menopause, and about 70% of them are obese or overweight. These data is actually from the US, and we believe though in Asians, the incidents are actually much more increased. And for Asians, you don't have to be overweight or you don't have to be obese. Even if your BMI is normal, because of our anatomy, you have an increased risk of developing obstructive sleep apnea. So how would you know if you have sleep apnea? So 95% of them would actually snore and would also bother their bed partner or family. In fact, most of the consultations that we get are not because it was initiated by the patient themselves, but that because some family member or the bed partner would bring them to the clinic because they're bothered by their bed partner snoring. They would say it's very loud that they can't sleep, and troubling because they would be catching their breath in the middle of the night. Nagugulat sila dun. They would hear those choking episodes. And if you ask patients who have sleep apnea, they would have restless sleep. They would say when they wake up, if they sleep for about 8 hours, they would still feel tired and sleepy. Loud snoring, well, most of the time it's their bed partner would tell that tulog sila. They would just say, tulog ako. I don't know if I snore loud. But they do complain of daytime sleepiness. They would start having problems with their memory, their intellectual capacity. They're not as sharp as before. There's some personality changes. They become moody. They don't actually tell us that they have some form of sexual impotence, but they say that they have headaches in the morning, and sometimes they have frequent urinations. They have frequent trips to the toilet. And we usually divide them into nighttime and daytime symptoms. And you can have these are the symptoms that they can actually tell you that occur during the night. They can be moving about a lot of times during the bed. They have frequent trips to the toilet. They would wake up not knowing why they woke up. Sometimes when they wake up, they have palpitations. Some even fear sleeping anymore because they have a bad experience. They would wake up sweating and gasping for air. And during the day, when they wake up, they don't feel rested. They feel fatigue. They have sleepiness. They have memory problems. They have trouble concentrating, so on. And most patients who have drug-resistant hypertension, those that have obese, those who have heart failure, those who have pacemakers and atrial fibrillation, diabetes, all those diseases would have concomitant sleep apnea. So if you have any of those diseases, better have yourself checked. If you do have snoring, ask your bed partner if you choke, and maybe you have to go through some testing so that we can confirm if you have sleep apnea. We treat them basically because they do have a lot of complications. Again, for nowadays, everything's preventive medicine. That's why we're having this talk, so that you can be aware, we can prevent things from happening, because once they happen, like if you have a cardiovascular event that's fatal or even non-fatal, you would definitely have a change in your life. The way you function, basically the way you live. Hypertension is present in about 50% of sleep apnea cases. You can have heart attack, you have atrial fibrillation. You can even have sudden cardiac death. And usually that occurs at midnight to about 6 in the morning. And it can worsen all these other problems. So the best way for us to understand, or at least diagnose you to have sleep apnea, is to go through a attended overnight polysomnography. So basically it's a sleep study. You spend an overnight in a hospital. We gather all these information. So all those channels, you basically have 36 channels attached to you. This is how it looked like. So you have all those wires attached to you, and while you're sleeping, we're observing you. And even children do suffer from sleep apnea. And the study is quite easy. All you have to do is sleep. That's your only participation. However, nowadays people are afraid of going to the hospital, and that's why we also have what we call sleep apnea testing or the home sleep apnea test. These are devices. It's not as it's not as complex, but it's not as complete also as an overnight sleep study in the hospital. But this would do for some patients, and you can pick up the device, or it can be delivered, and you do the sleep study at home, and the information is read. We bring back the machine, and we would read all the data that we get from the device. And we treat them with CPAP or continuous positive airway pressure. We give you oral appliances. You can also do surgery. And of course, this is kind of dragging lifestyle changes. You do have major weight loss and behavior modification. So that's quite hard because not a lot of patients actually are successful in doing weight loss. And this is just an example of what we call the positive airway pressure. Remember the illustration before the graphics. It shows you that the airway collapses, and with the CPAP, the CPAP actually opens up your airway, so it doesn't collapse anymore. And that's one form of treatment that we can give for patients suffering from sleep apnea. So what can you do? So there are other things, aside from if you don't have any of the diseases and you would like to improve your sleep, there are such a thing that we call sleep hygiene. They're quite easy, but they're easy actually, but these are behavioral things that you have to do. And the behavioral things, modifications, are actually quite hard for some to follow. But they're actually just easy. And if you can just follow them, it would actually eventually lead to a good and better sleep. So sleep only as much as you need to feel refreshed or you feel rested. We know that it's about 7 to 9 hours, as we mentioned. In real life, it's about 6 hours. But sometimes even if you sleep for about 6 and you feel rested, that's enough. Some people actually try to sleep longer. They would like to hit the 8 hours of sleep that they think is proper. But as long as you feel refreshed the following day, that's fine. So have a regular sleep schedule. So dapat regular. You have to have a regular wake up time. You have a regular sleep time. And you have to keep it regular even on weekdays. So weekends and weekdays, you have the same schedule. And don't force yourself to sleep. The more you force yourself to sleep, if you have a hard time sleeping, the more you cannot, the more it will not come in. Avoid caffeine beverages after lunch. Caffeines actually would work for about 6 hours from the time that you took them. So try to avoid them after lunch, and avoid clock watching. Sometimes if you have a hard time falling asleep, you try looking at the clock, watching the clock, watching when you can fall asleep. That's a bad habit, and eventually would lead to poorer sleep actually than pushing you to sleep. So avoid alcohol near bedtime. Some people would take alcohol to fall asleep, but it has a double effect. It can make you sleep, but at the same time, once it starts to metabolize in your body, it wakes you up. That's why people who drink alcohol, they would say, mababaw yung tulog, or they would wake up many times during the night. Avoid smoking because it's a stimulant. That's why some people, if they want to keep awake or they want to concentrate, they do smoke. And don't go to bed hungry because sometimes if you're hungry, you would wake up. But don't feed yourself naman. Don't give yourself a full meal. Sometimes a light snack would be okay, so that you won't wake up because you have hyperacidity or you're just hungry. That's why you would wake up in the middle of the night. Also, try to avoid too much liquids at night, especially before bedtime, because that would trigger you to go to the toilet. And sometimes that waking up would cause you not to be able to fall back to sleep again. Regular exercise is very important. It can tire you. Again, the more tired you are, the deeper your sleep would be at night. But as a rule, we would like you to exercise in the morning. But again, it's a case-to-case basis. Some people could still exercise at night, but still be able to fall asleep at night. But if you have a hard time falling asleep after an exercise, best to exercise in the morning upon waking up. So what should you do about your bed? So basically, your bed should be treated, para siya dapat, should be treated like a cave. So it should be cool, about 15 to 19 degrees, but then again, that's too cold for the Philippines. It should be dark, so dapat tahimik, so there's no light that would wake you up, or the darker it is, the deeper your sleep will become. And it should be quiet, so no noises that would interrupt you in the middle of the night. And bed, you should treat your bed only for sleep. So no, you shouldn't be on your phone on the bed. You should be watching TV, or bed is only for sleep and sexy time. So those are the only two things that are allowed on the bed. And if you are a person who does shift work and you need to sleep during the day, these are some tips that you can actually do. You have to wear dark glasses after your shift to block out any bright light on your way home, because the moment you get exposed to bright light, you're going to be awakened and you will have a hard time falling asleep when you get home. You have to keep the same bedtime and wake schedule, even on weekends. Again, regularity is very important. That would train your body to sleep when to sleep and when to wake up. Eliminate noise and light from your sleep environment. So, of course, it's hard to sleep during the day. It's usually the rooms are lit because of the sunlight. If you can have dark curtains, that's going to be good. But if you don't have any dark curtains, even dark mask would be eye mask would help to block the bright light. Avoid any caffeinated beverages and food close to bedtime, so meaning no chocolates, no coffee at the end of your shift. And try to avoid alcohol, although it may seem to improve your sleep initially. You can develop tolerance, meaning after a while, your alcohol consumption will actually increase in order to have the same effect. And it does disturb you during sleep. So this is my last slide. So basically, I would tell you just try to remember the rule of thirds, one third. So in order to live a healthy lifestyle, you have to diet, you have to exercise, but don't forget about sleep. And everyone sleeps about a third of your life. It's not hard to get sleep. It's not like something that you have to pay for. Sleep is actually free. So try to make the best out of it. So thank you very much.
All right, thank you, Dr. Aguilera, for that very well informative talk. I'm sure a lot of us here have many things to take away in this session. And now we are activating the live Q&A box to accommodate your questions for our guest speaker. Please write down your questions in the Q&A box found at the bottom part of your screen. So, all right. We have questions already here, Dr. Keith. So I'll ask the first question. Will you recommend melatonin if someone is having difficulty sleeping, and how long should this be taken?
But if you melatonin is actually part of your brain, it gets secreted. That's why I mentioned earlier that it's important that you have to keep your room dark and quiet, because the darker it is, the more melatonin your brain would be secreting. And that's why melatonin is very important. When you expose yourself to bright light, the secretion of your melatonin would stop immediately. So melatonin supplements are good. At least they're supplements, so they're not really bad. They also say that melatonin increases your immune system. At least that's what our natural melatonin actually does. But the problem with the melatonin supplements is that they're not created equally. So you can have in the market a 1 milligram, a 3 milligram, a 5 milligram. Sometimes you have a 10 milligram melatonin. You can even have micrograms, like 250, 500 micrograms. But the problem with the melatonin is that because they're not regulated, the purity of the melatonin is actually of question. So yes, you can take them. So how much? Usually we would start with 3 milligrams. But again, that depends on the brand. So you can also experiment with different brands and see which one works best for you or which dose actually works best for you. If you're going to be taking them, try to take them best 30 minutes to about 3 hours before bedtime, depending on your sleep target, meaning because melatonin doesn't work fast. So, and it also has a different effect in different people day. So you can try experimenting on that. But you take it before bedtime, 30 minutes before bedtime or 3 hours before your bedtime. You do have to take it regularly. So you have to take it it's safe. You can take it for a month if you'd like to. Before you would have any effect, actually, it would take you about a week or two before you would have any immediate effect. So to maximize it, you have to take it for a bit longer time.
Okay. We have our second question. If someone wakes up almost every day at 2 or 3 a.m., is this an indication of an illness?
Well, we have to go through that's why we give you a sleep diary. Why do you wake up in the middle of the night? We do investigate why you wake up. One is snoring, pwede rin siya, you tend to wake up at that. Sometimes you may have a lot of thoughts in your head, di ka masyadong relax. And that kind of intrudes to your sleep. So you go through different sleep stages during the night. And sometimes when you're in stage 1 or stage 2, that's when your light sleep is, and you have a lot of thoughts in your head. Sometimes it can also intrude and wake you up. And that can wake you up. That eventually would lead to an awakening during the night. And pwede yun. So other things then you have to observe if it's going to be regular. We look at the sleep schedule. Minsan kasi sometimes your sleep might be too long, or the sleep requirement, the sleep that you really need is actually shorter than what you think. And that's why you would have some form of awakenings in the middle of the night, maybe once or twice, and that can happen. But if it affects your work, that's when you start seeing us. Sorry.
All right, let's go to our third question. My average light sleep is 75% of my sleep duration, 2% only for deep. What does this indicate? Is it a warning sign for a serious sleep disorder? And are over-the-counter sleeping medicines safe?
So as for the sleep, as I mentioned earlier, the fitness watches, like I do have one. I try experimenting on different fitness devices, and they're just a glimpse. You don't take them to the dot. So light sleep, you basically do about 50% or 75% of light sleep. Deep sleep, sometimes it can detect, sometimes it can't, depending on the sleep device that you're actually using. The best gauge for you, it's just a guide, but the best gauge for you is you try to see if when you wake up, you feel refreshed. If you are refreshed, you're not sleepy during the day, you're up and about, then that means you're getting a good enough sleep. Sometimes sometimes you become, minsan nga, counterproductive because you tend to overanalyze your sleep. It's not supposed to be the case. It's just as a guide, whether you're getting enough sleep or not, or your duration of sleep is good, but you still have to listen to your body.
All right. Next question we have, how many minutes is required for a power nap?
Okay. For power naps, we would say about 30 minutes. That's a power nap. Kapag more than 30 minutes, hindi na siya nap, tulog na talaga siya. So
Sleep na
the
talaga yan.
reason why you remember the sleep stages that you go through, if you sleep within stage 1 and stage 2, which occurs within 30 minutes to about 45 minutes, and if you wake up at that sleep stage, you're okay. Talagang power nap. When you wake up, you feel refreshed. Okay ka, you're up and about. You're not groggy or cloudy. If you sleep longer and you start going into deep sleep, tas nagising ka or ginising ka, that's when you feel parang groggy ka or cloudy yung brain mo. So parang hirap, parang mas pagod ka pa nung bago ka natulog than when they
Parang
woke you
may
up.
heavy sensation pa rin yan sa head.
Yes, you have a heavy sensation in your head na parang hindi tuloy ka na-refresh. Parang nasira pa lalo yung ano mo. So that's why keep it short at about 30 minutes. If you can't sleep in 30 minutes, you may not need that nap. So just get up.
All right. Next, what is the best time to work out so that it does not affect our sleeping time?
The best time is actually when I advise is usually in the morning when you wake up. So the moment that you wake up, you can start exercising. Ideally, exercise in a brightly lit room, so that would start your day right. It would provide you the right amount of alertness and wakefulness. For some kasi, when you work out during the night, there's a momentum pa kasi after that. You secrete a lot of hormones inside yung mga, when you exercise, especially mga strenuous exercises, that would keep you awake for the rest of the night. So if you can't avoid or di ka talaga pwede mag-exercise in the morning, you can exercise at least 3 hours before your bedtime. You have to end 3 hours before your bedtime.
Next, are there exercises that can induce sleep?
Relaxation exercises are particularly useful for
Meditation
sleep.
siguro.
Meditation, breathing exercises, yoga, some form of yoga. They help you with your with relaxing, and then that they can help you sleep.
Even the smartwatches already offer that,
Yes,
Doctor.
that's right. You have that's why even in early smartwatches, wala kang sleep pa masyado, tsaka wala pang relaxation. Ngayon, meron ng meditation and
They
breathing
have breathing
exercises.
exercises as well. Next, why are some people harder to wake up than the others?
Again, ano ba yun? Bata? Again, there are, as I mentioned earlier, there are morning larks and night owls. So people who are usually mga night owls yan or mga evening person, they sleep late, they also wake up late. Also, you have to take into consideration the age. Children actually sleep longer. So that's why there's a movement in the US wherein they would like to start school later during the day, not rather than asking children, especially kapag teenager, to attend school early. It's because physiologically they do sleep late and it's hard for them to start the day when you wake them up early.
Next, we have why is it sometimes when I have shorter hours of sleep, I am more functional and productive than when I have longer hours of sleep?
Again, that's the ano there is the regularity. So you have to have a regular sleep schedule. If you do have, baka tama yung gising mo when you woke up, nung maliiksi yung tulog mo eh. Again, as when you wake up, minsan kasi yun, when you wake up, when you have a regular sleep schedule, your body learns that. And before your desired wake up time, so your body would, for example, you wake up at 7, regularly at 7, your brain actually would put you on light sleep na lang before the wake up time. Ganun siya. But if you have an irregular sleep cycle, I mean irregular sleep schedule, nalilito siya at what time you're going to be waking up and things like that. And sometimes behavior natin kapag wala tayong gagawin is sometimes we extend our sleep. So, gising ay wala mang gagawin. So, I'll sleep again. So, you would, tapos pagising mo parang feeling mo mas groggy ka o mas hirap ka gumising. Then that means baka nagkaroon ka ng sleep inertia. So, pagising mo, mahirap, ayun, hindi ka masyadong refresh. So, the morning na maiksi yung tulog mo, just look at that time, try to see what time that was. Maybe that's your body telling you that's the ideal time that you should be waking up.
I think it also comes down to practice, Doctor.
That's right.
Next, what can you suggest we do if our kids are afraid to go sleep in the dark?
Okay. So we do have we in our sleep clinic in the hospital, we do have a pediatric sleep specialist. So they do train children or actually they train children and their parents so that they can may mga behavior modifications kasi. So usually stepwise din siya. In the beginning, you start kumbaga sleeping with them. Also naman in the Philippines, you do co-sleeping. So you just give them assurance that it's safe to sleep in the dark. Maybe you have to, pwede kang mag-ano ng maliit na light just to assure them na mayroong ilaw that they can see. Pwede hindi totally dark talaga siya. And you do graduation. Parang dahan-dahan mo siyang introduce to darkness. Huwag mo siyang bibiglayin.
Next question, is a 5-hour sleep enough for 60-year-old person?
As you get older, sleep actually becomes shorter. So sometimes, even if you sleep for 5 hours, as long as you're as long as you feel refreshed the following day, baka yun talaga sleep requirement mo ninyo. And as you get older also, we see them in mga elderlies talaga, they do sleep short. They sleep early pa pala. Aside from sleeping early, they wake up early. And when they wake up early, yun yung problema actually kasi wala na silang magawa. But sometimes they also sleep during the days. Marami silang multiple naps. If you actually add them all up, baka hindi lang pala 5 hours. Pero as long as you're, again, going back, as long as you feel refreshed, that's fine. If you're still sleepy, we can still work on that.
Right. Next question. Hi, Doc. I'm always taking Slepasil for me to have a good night sleep because I always wake up after 3 to 4 hours. I know that taking this kind of medicine is not always good. Any other suggestions to have continuous sleep?
So as I mentioned, yung mga sleep hygiene that I mentioned, try doing them, doing those. You may have some behaviors that are unchecked, like watching TV on the bed, staying on the bed, not actually sleeping, reading. You do have a lot of activities. Something a lot of people actually do. So minsan nasa kama sila, hindi man sila natutulog, marami ginagawa. That actually hurts your sleep. So if you go to bed not doing anything, you actually slowly introduce other things. Now, aside from sleeping as a purpose for your bed, and this can actually disrupt your sleep. So melatonin actually works. So okay naman, safe naman siya to take melatonin. But try to consider going through your habits at bedtime din siya. So try not to, again, regular sleep and wake up time. Don't spend too much time on your bed. Only go to your bed whenever you're sleepy. In fact, just enter your bedroom if you're feeling sleepy. Try to have a time to wind down. Yung relaxation meditation exercises also help. So try doing those things.
Next question. Is it okay if you sleep with your head elevated? Example, two pillows underneath, or is that a sign of illness that you can't sleep restfully lying flat on your back?
Yeah, that's possible because most people try to see if you snore. Because some people who have sleep apnea, they can't sleep on their back na flat. So they have to have about two pillows to prop them up so that the tongue doesn't fall back. They sleep better, or they sleep better on their side. So there might be or sometimes pwede lang as simple as reflux that can happen during the night, and that's why they can sleep better when they're lying a little bit inclined. So more natural sleep talaga is you can sleep on your back if you can sleep on your back well. So yun yung ano talaga. But yeah, it could be a sign if you need to sleep inclined kasi hindi ka makahiga ng flat.
Yeah. Next, I may have missed this earlier if it was discussed, but are there other supplements that can be taken besides melatonin, and is hot tea advisable?
Caffeine basically depends on your tea. If your tea has caffeine, so we wouldn't recommend taking caffeine at bedtime. So some teas they say wala naman siyang caffeine daw. As long as it doesn't contain any caffeine and you can confirm, then it's okay to take tea. But it's not a guarantee. It's not a medicine. There's no tea that can actually put you to sleep. Melatonin is one that you can buy over the counter. There are two others that can, herbal that can help you sleep, which is valerian root, tsaka St. John's wort. Sila lang yung alam ko may mga studies that can help you sleep. In fact, those two other ingredients are present in your sleep pill other than just the melatonin. So yun siya. But sometimes kasi it's the habit or the behavior of just taking something, a hot water or hot tea at night, calms you down. If that works for you, that's fine.
All right. Next question. I never dream. What does it mean?
Everyone dreams. Everyone dreams.
Probably you're dreaming in a dream, no?
Everyone dreams. In fact, you go through dream sleep about 4 to 6 times in the night. But you don't remember your dreams. Sometimes it's problematic if you do remember your dreams. If you do, that means during the process of dreaming, nagising ka. No? So if you wake up, if you remember all your dreams are very vivid, there's something probably wrong because you were awakened during those sleep stages. No? Again, mahirap mag-generalize. These are just possibilities. And there are people who talaga don't dream. And these are people who have, as I mentioned, you may mga sleep apnea. It's because every time that they sleep, they go through the different sleep stages. When they hit deep sleep, tsaka REM sleep, that's the deepest sleep that you go through. And your muscles are much more relaxed during those sleep stages. Magigising ka or magchochoke siya, kaya ginigising siya ng katawan niya. And every time they go to that sleep stage, ginigising siya. That's why they really don't dream because your body's kind of preventing you from choking. So para siyang defense mechanism ng katawan mo para hindi ka mag-choke to death while sleeping. But if you're a normal sleeper, it's just normal not to remember your dreams.
Right. Next question. What's your take on drinking hot milk at night, lighting scented candle, or Himalayan salt lamp to help someone have a good sleep? Because
If it
you
if
see
it
it in
works for
the
you,
malls.
oh, the
Diba?
salt lamps, saka mga essences, lavender, they would say, may mga recommendation pa nga sila. But
Yeah. Pero
whatever works for you.
are they advisable also, Doc? I mean, is it safe to have it on every time you sleep?
I don't, well, siguro sana kapag napatay na yung candle before you sleep. I mean, it's more of a fire hazard. But those things kasi are whatever calms you down. So basically, all these things like Himalayan salt, the lighting, the scents, all of them actually conditions you. So if you're conditioned, if you're more relaxed, then you start falling asleep. Ganun siya. Like, like when you check in a hotel, di ba? They're scented, they're
Hmm.
quiet. Iba yung ano niya, parang ang sarap matulog na kaagad. But
Yeah.
basically, whatever it takes to create a nice sleeping space for you, I'm all for that.
Okay. Next question is snoring something serious that really needs medical attention?
Yes. As I mentioned earlier, snoring is actually a hallmark that there's something wrong with the airway. And especially if you have other comorbidities like hypertension, diabetes, heart conditions, any heart conditions, that would actually prompt us to investigate further. So we do advise you to see us. You might have to do a sleep study to confirm that. And snoring is not only for adults, even for children. You can have some snoring issues, and it affects them differently. And oftentimes, they would have hyperactivity, inattentiveness, poor school grades. Those are the manifestations of children who would have some snoring issues or sleep problems.
Do nasal spray help in uh, minimizing
So
snoring, Doc?
if the cause for the snoring is due to some allergic rhinitis, which can clog up your nose, yes, it can help. And for some people, when we start them on medications for the allergic rhinitis, opens up the nasal cavity, they actually sleep better.
Right. Next question. Does reading before bedtime help you sleep?
It does. Reading usually not on an iPad because on a tablet because of the bright blue
Blue light.
light that they emit that would actually push your uh, sleep time much later. So we would advise you to read on a book or read Kindle, dim light, but try to read off your bed. So when it's good to read, but read not on the bed, but try to read on a chair or on the sofa. And as soon as you feel sleepy, then you put down the book and then you go to bed.
Next, is there a prescribed sleeping position?
Okay. Normal sleep position naman talaga is to sleep on your back. Sometimes it helps for mild snoring. It can help if you sleep on your side. But for the position, I'm more particular with the pillows and the bed. So when you're lying on your back, make sure that your pillows not too high and you should start from it should reach your shoulder para hindi masyado nakabend yung neck. When you sleep on your side, if you prefer sleeping on your side, try to sleep with a higher pillow so that it's in the right angle with your neck and shoulder so that it won't be bent or it won't be overstretched. And that can cause some neck problems in the morning.
Next, I think this will be our last question for this session. Can you give a glimpse on what is being done during a sleep? Ano ba yan? Yan, yun na lang. Is sleepwalking true and harmful?
Hindi ko na
Is sleepwalking true and harmful?
Is sleepwalking true? Yes, it is true. It's an occurrence. It's one type of parasomnia wherein patients actually wake up and start walking. Is it harmful? If it's just sleepwalking in itself, so wala siyang trigger and things like that, safe naman siya. So meaning basically when you treat people who have, of course we try to find out what's causing the sleepwalking. And if we couldn't find any cause for the sleepwalking, they're not actually harmful for the body. You just have, harmful for the patient or for the person, but you have to keep them safe, meaning that you have to keep the environment safe na wala silang mapapangga, hindi sila madadapa, and things like that. And sleepwalking can be as complex. They can go down to the kitchen, open the ref, eat, and then go back. It's actually associated with the eating disorder. Yun yung pinaka-association niya in sleepwalking. Some people even drive when they do sleepwalk, although it's really hard to document. But they do have documentation in the US na talaga nangyayari siya. But kung sleepwalking lang, okay lang siya. You just have to keep them safe. But ang goal namin is to find out what's causing the sleepwalking.
Okay, I think that will be our last question. We apologize for all the attendees that we are not able to answer the remaining questions due to the lack of time, but we thank everyone for the questions. Again, thank you, Dr. Aguilera, for helping us know more about the utmost importance of good sleep, common sleep disorders, and for all the tips you have shared in getting better and quality sleep, especially these very stressful days. Our attendees have gained valuable information on one of the factors that we should consider a priority for better health. We truly appreciate you for taking some time for this webinar. Now, to wrap up today's online event, may we call on screen the Medical Director of Generali Philippines, Dr. Marian Lopez.
Thank you, everyone. Thank you, Dr. Kit. Thank you for attending this Gen Wellness webinar, which is exclusive, of course, to our Gen Wellness pilot accounts. I know that we have learned something useful and something new about sleeping from Dr. Kit, and I hope that we will take it away with us and not leave it here. I also encourage you to maximize the use of our Gen Wellness platform. It is very useful nowadays, especially during this pandemic, where health is truly our wealth. So thank you again, and enjoy the rest of your day and sleep tight. Thank you.
All right. Thank you, Dr. A. Again, thank you to our partner for today's webinar. That's Sleep Science. If you wish to know more about them or their services, you may visit them at www.sleepscience, but that would be, the science is with 3 Z's. So science, sleepscience.ph. So there you have it, everyone. On behalf of General Life Assurance Philippines, thank you for joining us today. And we look forward to seeing you again for our next webinar. Once again, I'm Deo Castillo of Generali Philippines. Thank you and enjoy the rest of the day.
I'm living good, I'm living great. Everything I do